So starting in the coming months, there's going to be a change to asthma injection treatments for people in Texas with Blue Cross Blue Shield. Joining us today is Dr. Mery, board-certified asthma, allergy, and immunology physician and founder of Hill Country Allergy and Asthma in Austin. Appreciate you being with us to talk about this really important topic. So for Texans out there that or who have asthma, how is this going to affect them? They have to start doing this at home, right?
I think the goal with the insurance companies, is specifically Blue Cross Blue Shield, is for them to receive these immune modulating medications at home without doctor supervision.
Right. Now, the insurance provider will still be paying for this, is that right? But you're just going to do it at home.
I suspect they will. I mean, I can't speak to their business model.
Yeah. Well, and also, of course, the doctor would have to deem it safe for the patient to do these injections themselves. So what patients would not fall under this, and how would that work?
I mean, if you're asking me, you know, in my view, I think most patients have a challenge in giving themselves injections because these patients are at higher risk. And so they tend to be allergic patients. So they're already at an increased risk of an allergic reaction. And then couple that with bad asthma, which is, you know, obviously difficulty breathing, and you're giving them these immune modulating medications that they can potentially react to. So it's, you know, it's quite a challenge.
And so if there's like patients on the fence about this, is there going to be any kind of protocol to help train them? Or I can imagine giving myself a shot. So will they be trained in how to do it properly? And
we certainly do our best to train them. We have, you know, staffing resources in the office to train them, but, you know, it's very difficult to train them on a potentially life-threatening reaction because in the moment, unless they have supervision at home, which they have to coordinate,
okay.
You know, it's very difficult to train and predict when a severe reaction is going to occur.
As a doctor yourself, what is your reaction or your thoughts about an insurance provider making this decision?
Gosh, that's a complicated question, right? Because in our view, the goal is to take the best care of our patients.
Yeah.
That's not necessarily the goal of this particular decision-making process.
And if patients feel, you know, if they don't feel comfortable doing the injections on their own, we may have mentioned this earlier, will there be support systems? Will there be some kind of support in place for that? Well,
certainly if they come into our office, there's support. You know, we don't go to their home. And so we educate them, we show them how to do it, we provide them with instructions, certainly both from the company that produces the medication and in our office. And then we're always available to answer questions during the office hours.
Yeah. And also, too, with this in mind, are we seeing more asthma patients, or is that, can you follow that? Can we trace that? Are we seeing more people come down with this?
Yeah, absolutely. Well, I mean, we live in a toxic soup in our environment, our food supply, things of that nature, and so, you know, that increases inflammation. Asthma is an inflammatory process that attacks the lungs, and so you are seeing a rise in inflammation in a myriad of organ systems, and asthma is one of the biggest.
And are there different types of injections, or would everybody who has an injection would have to do this at home eventually?
There's different types of injections. There's several on the market currently to treat asthma. I don't know what the plans are for any other medications or what their plans are fiscally for those organizations.
All right, doctor, thank you so much.
My pleasure.
Thanks for your insight. Appreciate it. You too. Now, starting on April 15th, if deemed not medically necessary by your doctor, the following drugs there on your screen can be self-administered. There's a list of them. If you have any questions about that, you can call the number on your member ID card.